Hello, everyone. Dr. Nikhil Verma here with another edition of Things I Didn't Learn in Med School. Today, I want to step away a little bit from the lifestyle medicine stuff I've been talking about in the past few weeks, and I want to focus on the UHC, the United Healthcare Insurance Company, and what's going on with them a little bit. And I also want to dive into some laws that have been proposed to legislation in Oregon and California that is limiting the private equity side of things, investing into healthcare practices. This video is going to be beneficial for anyone that is in the healthcare world, healthcare industry, anyone that's a physician, a nurse, um, hospital administration. This is also important if you're a patient out there and you're kind of confused with what's going on and why some of these physicians are pulling away and starting their own practices, or why physicians are even selling out to private equity in the long run. And I think it's going to be very insightful for a lot of people. And at the end, I have a call to action. I have something that I'm proposing for people out there that want to change what's going on. Actually, a couple calls to action, and we'll get to that later on in the video. So the first portion that I want to talk about is, we'll start with the private equity side of things. Just recently, at the end of February of 2024, Oregon has presented a bill to the legislation, the lawmakers there, to say, hey, we got to get the private equity out of this healthcare sector. They are dictating how we're treating our patients. They're putting profits of the private equity over the health of our patients and doing what's right. This is the only time that I can get behind physicians binding together and being like, what are we doing here? We should not be a profit making entity just for private equity. We should be helping out the patients first and foremost. But that also involves being in a business. And when that business is running for someone else to take a bigger chunk out, then that's where the issues come. And we're seeing decrease in patient care. I can't say in every single spot across America, but it is happening. And it's happening at such a wide spread effect that people are starting to notice. I have a private practice and I don't have the opportunity to see a lot of patients, but I see how these industries that can pump in a lot of money for advertising and patient acquisition and force a patient to feel like they have to stay within that ecosystem or that system, and not let them go out to a private practice. And that squeezes the private practices to pinch every dollar that they have and not be able to be as effective as I feel like I can be, for example. And that is drastically affecting patient care and the amount of people that I can help, in my opinion. This isn't a new idea. This has actually been proposed in 2022, 2023. It just kind of never took much. It never got ahead of steam. And now I think it's starting to build up as there's just written testimony after written testimony from patients, from physicians, from healthcare workers. And we're seeing it across the nation. California is starting to propose this as well. And I don't see a future where other states aren't going to pick this up. I believe Texas was talking about something similar. I can't name all the states off the top of my head, but this is something that's really, really pertinent to patient care and patient access. Not only that, it's the private equity groups will go around and increase their leverage with the insurance company to charge more money to the patients, have a higher deductible at, we'll say, their surgery center or their hospital. And this is where they get away with the billing. The No Surprise Act that was passed was supposed to be a really good thing for patients, but all that really did is just saying the hospitals are allowed to now tell you how much they can charge instead of surprising you how much they can charge. There's way more detail into that that I'm giving justice to, but I just want to kind of put that out there. The interesting thing is that there are laws passed in the past, anti-stark laws and antitrust laws and other laws that was essentially saying that physicians are not allowed to invest into other practices. You can't pay for referrals. You can't do these certain things in the eyes of the government when seeing patients because they thought it would cause a lot of dirty physicians that are just going around and making a bunch of money and not caring about the patients. Well, if you really look at it, that's all this is. Private equity became smart and said, hey, why don't we just pile a bunch of money together? There's no laws against us doing this. It's only laws against the physicians and healthcare workers. So we can still make a bunch of money, but we're not the dirty ones. We're just helping out. And that's what they sell to people. Um, and in my honest opinion, I've lightened up a little bit to the idea of private equity just because of the idea they can fund a practice, but the idea is year after year they're going to want a significant return in value, and if you're not making that and working harder and harder and harder, they're going to fire you. And I know this because there are 3 physicians in the same field that I'm in that were hired by big groups, and all 3 of them have been fired within the past year. That is amazing to me that they went into these jobs thinking job security for these big markets, and they weren't producing for what that company wanted. Now, obviously, there's other reasons that might have been involved, but that's just how they treat you. They will build this practice up for 3-4 years, or this individual up for 3-4 years, and then turn around and fire them, and they'll hire someone new for cheaper. And that's the nature of the beast, and that's the circle of how it goes. So now I want to move on to all these things that are going on with United Healthcare. United Healthcare is an insurance company, probably one of the biggest insurance companies in the United States. It also is the biggest employer of physicians in the United States. So that's kind of interesting. The individuals that are providing the insurance are also paying the physicians to see the patients. We can already see the conflict of interest in that small sentence right there. Why would the insurance companies want to pay both sides of the spectrum? So that it's a really tight control. So the Department of Justice of the United States, this last week of February 2024, has opened up an investigation of United Healthcare. And this isn't just one thing that's happening. This is a combination of multiple things. So that example I just gave you, it's an antitrust investigation. Are they really helping out the patients, and are they helping the services that they're supposed to be servicing? That's just one part of the investigation, and that's kind of what kicked things off. I'm kind of reading some of the highlighted points on this ticker over here, and it's essentially talking about what I was just referring to, of how physicians are not allowed to invest in other physician groups, or they're not allowed to have relationships of paying for patients and stuff like that. But Optum, which is a subsidiary of United Healthcare, acquires doctors' offices, and then they refer within the own United Healthcare working system of Optum Healthcare. So it's, again, a very sketchy way of doing the business, especially if they're the ones that are paying into the doctors and paying the patients and paying themselves, and it comes into a big circle of how they are paying themselves, going from the pockets of the patients to the physicians' offices, and as well as United Healthcare. Well, I guess it should actually go more like this. The patient's paying their premiums and they're paying their deductibles throughout the year. And then all of that, and we all know deductibles have risen over the past 3 to 5 years significantly. So people are paying thousands and thousands of dollars for their deductibles on top of their monthlies, which are sometimes $400 to $1,000 themselves. So multiple thousands of dollars are going straight to United Healthcare. United Healthcare is cutting physicians' fees, but they've acquired the physicians' offices. So when they've cut the fees, they're getting all the payments from the patients. a lower cut's going to the physicians, and it's just a circle of the top getting bigger, 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 physicians kind of getting shrunk, 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 and obviously the people that are affected the most are the patients in these systems. There's also something called Optum Premium or Optum Suggested Physicians that come up to the top of the list. And these are for services potentially, and this is part of the investigation, services that are higher paid services that they would prefer to go to an Optum physician because they can control that price structure with this contracts versus another United Healthcare physician that might work for a hospital. So they force you to go to a physician that you may not be best suited for you, just so they can get a better rate. And this is also causing smaller hospitals and smaller independent practices to shrink, 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 and kind of be forced into a hand where they have to be bought out by private equity or by Optum, et cetera, et cetera. So the United Healthcare fiasco doesn't end there. They've already been in investigations since fall of 2024, fall of 2023, where they were using artificial intelligence to deny medical care for patients. And this was strictly in the Medicare Advantage plans. And they were using this automated system to review the notes from physicians and deciding yes or no if a procedure, if a test, if a medication was approved or not. So literally taking the human aspect out, that's one thing. But what we started realizing is that everyone writes their notes. The notes are what we submit to the insurance company in a different way with a slightly different tone. And they were falsely denying things that they shouldn't have denied. So they're already under investigation for that. And this is on top of this other antitrust investigation. Now, another thing that's happened, again, at the end of February, probably mid-February 2024, and it's been going on for about 2 weeks now. Change Healthcare, which is another subsidiary of United Healthcare, was under a cyber attack. And they aren't able to pay physicians because of this. We can't submit reimbursements, and they aren't honoring them and paying them. Not only that, we can't submit for prior authorizations for procedures or medications or physician referrals if you need one. The Healthcare Business Management Association sent out a message on March 1st, 2024 about having an emergency town hall because this is drastically affecting practices. I know in my practice, I probably see anywhere from 10 to 15% of United Healthcare patients a week. So imagine what bigger hospital systems and these Optum Select practices are having to deal with and how much percentage of their patients are getting affected. So a few points to be made about this Change Healthcare cyber attack is there's been tons of pressure. Everyone is calling United Healthcare. They don't have an answer. They've given absolutely no response, no public response, despite other insurance companies giving public responses of how it's affected them. They've given no guidance on how to proceed, especially on the payer side. This has been reported to the departments of Medicare and Medicaid, and this can help maybe put some pressure on United Healthcare, but they don't necessarily fall under the same rules. So there's a lot of pressure on that side. And now it's the next step is all the groups banding together and getting involved to talk to Congress committees and government affairs offices, because this is a massive thing. We're not no longer talking about just payments. We're talking about affecting patient care. And this is a major issue, obviously. We don't know a solution to this right now. So it's kind of a big fiasco of domino effect of what's happening in United Healthcare, who was heralded for stock market industry for their massive quarter earnings last year. Well, this year, in 2024, it seems to be they've taken a massive hit and some things are balancing out. I don't know what the landscape of any of this looks like in the long run, but I will conclude coming to my calls of action at this point. Number one, if you are looking for good healthcare, solid healthcare, someone that's going to actually care about you and work with you, probably work on other parts of your health than maybe a big hospital system has time to do because they're getting so much pressure from overhead. Come work with me. I'd love to help out. I'd love to see what you're dealing with. I don't know if I'm the right physician for you. I don't know if I'm the right health advisor for you, but I do think I have a good pulse on a lot of issues. I'm very knowledgeable about what functional medicine has to offer, what I believe is true and not on that side. Integrative health. I do a lot of interventional procedures that are very beneficial for neuromuscular and musculoskeletal conditions. And ultimately, I got into medicine because I want to help people. I wanted to use the knowledge that I have, be able to synthesize it and redistribute it to use for other individuals and help people live a healthy and better life. I want to get away from this insurance model for that reason. So send me a message on, YouTube, LinkedIn, Instagram, wherever you may see this, and let's work together because that's where my passion is. My number two call to action is I'm not affiliated with this group outside of me being a member of them. And the company is called Doc Nation. They are trying to put physicians first. And they're trying to get a strong amount of people to get together and battle some of these bigger battles that individual practices or individual physicians cannot fight. We are taught so much in medicine to be divergent and fight against each other from different scopes of medicine, where a spine surgeon won't get along with the interventional pain physician because of certain things, of certain procedures. But we really need to bind together and work together to try to fight some of these things. They have some great options and great ideas. Go check them out. Again, it's called Doc Nation. I know the members of the board. A couple of them are good friends of mine. So I encourage you to check it out and see if you're a part of this mission too. Let's see what we can do to help other people out and make the world a better place. All right, everyone. I hope you found this useful and enjoyed it. Please drop me a comment below, ask questions. I want to know your takes on these things. And want to talk about it more, and we'll go from there. All right. Take care. Bye.